reverse T3, or we call it RT3. It is an inactive form of T3 that is produced in the body, particularly during periods of stress. It differs from T3. RT3 differ RT3 differs from T3 in that the missing deiodinated iodine is from the inner ring of thyroxine molecule, as compared to the T3 where the deiodinated iodine is from the outer ring. Whenever there is deiodination of T4 into T3, the iodine molecule is deiodinated, is removed from the outer ring in T3. But sometimes it happens that the iodine is removed from the inner ring of the thyroxine molecule, and it results in the formation of RT3. It is made by a blood test. Under normal conditions, T4 will convert to both T3 and RT3 continuously, and the body eliminates RT3 quickly. But under certain conditions, more RT3 is produced and the desirable conversion of T4 to T3 decreases. This occurs during fasting, starvation, illness such as liver disease, and during times of increased stress. This shows the formation of both active T3 and RT3 during deiodination of T4. So during these stressful conditions, the formation of RT3 becomes a vicious cycle, and it competes with T3 as a substrate for 5-deiodinase enzyme, which this enzyme causes the deiodination of T4 into T3. This inhibits the conversion of T4 to T3, with more T4 being converted to more RT3. An increased production of RT3 is often seen in patients with disorders such as fibromyalgia, chronic fatigue syndrome, Wilson's thyroid syndrome, and stress. Measurement of RT3 is also valuable in identifying sick thyroid syndrome, where active T3 is within normal range and RT3 is elevated. Now, the daily rate of secretion of thyroxine and triiodothyronine, about 93% is thyroxine and only 7% is triiodothyronine T3. 93% is T4 at the time of release, and only 7% is T3. But during the next few days, about one half of T4 is slowly deiodinated to form additional T3. The hormone finally delivered to and used by the tissues is mainly T3, which is total of about 35 micrograms of T3 per day. Almost 99.5% of T4 and T3 circulates in combination with and binding with the plasma proteins. Only 0.5% of the hormones remain in the free form. The plasma proteins are albumin, thyroxine binding prealbumin, and thyroxine binding globulin. These are the plasma proteins which bind with the T3 and T4 and carry them to the tissues. The normal plasma T4 level in the bound form in adults is about 8 microgram per deciliter, and T3 level is about 0.15 microgram per deciliter. Free T4 level is about 0.002 microgram per deciliter. It is the free thyroid metabolic hormones that are physiologically active. As these hormones are plasma protein bound, so they are released slowly to the tissues. Half of the T4 is released to the tissue cells about every 6 days, whereas half of the T3, because of its low affinity with the plasma proteins, it is released to the cells in about 1 day. They again bind to proteins within the cell, and they are stored in the target cells themselves, and they are used slowly over a period of days or weeks. So these hormones are stored in the thyroglobulin in the thyroid gland itself. There are also stored in the target tissues of these hormones. These hormones have slow onset of action and long duration of action. The latent period is long, it's of 2 to 3 days, that then reaches a maximum in 10 to 12 days, and then it decreases with a half life of about 15 days. Some of the activity persists for as long as 6 weeks to 2 months. T3 acts 4 times as rapidly as T4 with a latent period as short as 6 to 12 hours, and the maximum cellular activity occurs within 2 to 3 days.